people retire, we do not replace them. Our colleagues have been serving for more than 15 years, 10 years, even without promotion. This has actually demotivated our members. And we're asking you, Bwana Governor, we know wewe ni governor mchapakazi. Tunaomba because ile support umetupatia tunashukuru, but tunaomba ya kwamba you support sisi, you must be able to promote our members. We want to see our members being promoted. And number two, if you look at the population ratio in Makueni, we are talking about close to 1.1 million. Against, if you look at our members around PHOs around 85. You cannot, the 85 PHOs cannot be able to manage a population of around 1.1 million Makuenians. We were asking, because the WHO ratios are actually very clear, that one PHO is supposed to take care of around 6,000 members. We are actually falling below the threshold of WHO threshold. We are asking you, Bwana Governor, give us a budget to be able to employ and replace. And to do the replacement, you need a budget. By the way, if for example, I'm working and I retire, it's assumed that we retire at a higher job group. We are supposed to be replaced like immediately. So this we know for sure that Makueni has not been replacing our colleagues, and we are asking our chief of the whom we know is a good man, and we know even our CS is a good person. Please organize in this financial year. This replacement of this financial year, we want to see them being advertised so that we can be able to have the numbers of PHOs in Makueni increase. Comrades, power. Last but not least, we know there's FIF Act. We know there's facilitation. But that facilitation is coming to us. You know what part of what we do? We move around. We do disease surveillance. We need motorbikes. We need means, we call them means of transport, utility vehicles. Our CPHOs and our directors have not been facilitated. We are asking the governor to set aside utility vehicles for public health officers to conduct public health interventions, so that at least we can be able to bring down the burden of disease in Makueni County.
Issues on promotion, for the delayed promotions and redesignation, like most of our colleagues were redesignated in 2019, and by today they've not been promoted. So we shall ensure that all these issues are addressed and solved once and for all.
Now that we can fight for our department and follow up what is supposed to be done as a department, because most of our work has been taken by other departments, and we want to fight back and bring them back. For the duties we do currently, I work along the Mombasa Road, and we are really fighting the diseases. Currently now we have Mpox, which is fighting us. And the people along Mombasa Road, we are having cases for Mpox, and Public Health Department is the forefront of fighting the disease. And because of shortage of staff, we are really going to fight for our department to employ more public health officers so that we can bring the disease burden down.